Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley, and we got an absolutely fantastic show coming your way today. Again, always. Guess what today is? It's 360-degree health, and I got my main man here, Dr. Michael Mantell. How you doing, sir?
I'm doing great, and it's so good to see you both. And I'm so excited about today's show. We always have great guests. Today, we have a sparkling guest who's going to bring us an interesting take on one area of medical practice. I can't wait to get into this.
Wow. How you doing, Dr. Cooley? How you doing today?
I'm doing good. I don't think we ever had this topic on the show before, so this is definitely going to be interesting. So don't tell anybody about it. I got to do that intro with me. But we're really interested in hearing what this amazing guest has to say to educate the audience.
Hey, I am interested in this, and I tell you what. Hey, Todd, can you hear me? Are you there, Todd?
Yes. Yeah. Boy, 360 Health. You cover everything from head to toe and a little in between.
Or not necessarily little, Todd, but in any case, let's keep moving on.
Hey, Todd.
There you go. Yeah, it's going to be a great show. I love it. We're starting in 10 seconds. You guys ready to hook up with the radio and start the show?
Yes, sir.
All right, here we go.
Trade to 76626. Stop trying to find the right stocks to trade on your own. Just text trade to 76626 now.
It's Your Life is sponsored by James J.C. Cooley.
Dr. James J.C. Cooley. The James Cooley Show.
Hello, welcome to the James Cooley Show. It's your life. It's
Hello,
your life.
Welcome to the James Cooley Show. It's your life, I tell you. We got an absolutely fantastic show coming your way. We got all the platforms locked in right now. We got television, radio, 65, 66 live streaming platforms. And I tell you what, welcome to the show. Welcome to the show. And it's good to be back. Todd, it's good to be back, man.
I'm glad you're back. It's always awesome when you're live and live in action.
Live in action. We got this absolutely fantastic guest in this topic, and I'm not going to steal Michelle Thunder because she's going to give me that look and say you did it again. She gave me and Dr. Mike that look last time. you remember Mike?
I remember very well. That look is not one you forget.
So I tell you what, whichever platform that you're watching us on, if you want to be part of the show, all you have to do is go to the comments, ask any question that you might have, or you can pick up the phone and dial 1-888-344-1170. Let me tell you that one more time, 1-888-344-1170. Michelle, can you please do the honors and introduce the show?
Oh, most definitely.
The purpose of the show and introduce this absolutely fantastic guest.
Oh, most definitely. So it's 360-degree Health Day. And we're talking about wellness beyond medicine, urology, and life coaching. Wow. So Dr. James, we're all sitting down with a discussion with Dr. Diana Londoño. She is a board-certified urologist, Reiki Master, Pranic Healing student, and author. We're going to talk about diverse range of medical conditions pertaining to urology, how she brings integrative whole person medicine into her practice, how being a life coach is used in her practice, and how can we help physicians become healers and not providers. So Dr. Diana Londoño, again, she's a board-certified urologist and one of the 10% of urologists in the United States who is a woman, and the 0.5% that are Latinx and a woman. Dr. Londoño is originally from Mexico City and she received all her education in the Los Angeles area, going to Claremont McKenna College for her undergraduate studies, then attending UCLA for her medical school training. She finished a 6-year residency in urology at Kaiser Permanente in Los Angeles. She's experienced burnout twice, which led her to use her experiences to write and speak about it to raise awareness and help others. She's published multiple articles in outlets such as Medscape, Dimexity, Kevin MD, Men's Health, Giddy.com, MedMic.com, and others. She's also a contributor author to the books Thriving After Burnout and Medic SOS, and she is so much more. So please welcome to the show, Dr. Diana LaDonna.
Hey, Diana, welcome, welcome, welcome.
Well, thank you so much. That is such a kind introduction, and I'm just like humbled by it. And really, really just thank you from the bottom of my heart from having me here. I've been so excited and looking forward to this day. And again, thank you. This is just going to be amazing. So I'm looking forward to it. Absolutely.
Wow. We are so happy that you accepted and that you're on to educate our viewers and our listeners and also educate us.
I'm going to learn too, so don't worry. We're all going to learn. So
We're all going to learn
all
to grow.
from each other. So it's going to be good.
Okay, so Dr. Diana, other than what Michelle, I mean, I know you mentioned something in the bio, but can you tell us what's not in the bio? What makes you happy? Why are you so passionate about your job? Where you from? Where you grew up?
Yeah, so I am from Mexico City. I was born there. I was raised there. I lived there till I was 12, and then I moved to Southern California area, as you mentioned, to do all my schooling here, except for a 4-year hiatus in Miami, and then I came back now to Los Angeles again. But what makes me happy? I mean, what makes me happy and gives me purpose are these type of conversations, really ones where we dive deep into things about life, things about people and how we relate to each other and how we can help each other and grow. So that really is what drives me. And people even ask me, like, why do you do urology? And, apart from loving old men, and I do love grumpy old men and all men, but, I really do like the fact that what I do in my day job really has to come to a place of trust in a very quick time, because the conditions that we deal with in urology are things that may bring shame, embarrassment. They talk about intimate things like our erections, our sexuality, or lack of, and leakage of urine, problems peeing. I mean, these are things that are very, private, and many people are not comfortable with to bring up to even a specialist. So in a very quick time, I have to establish a rapport and a trust so that somebody can tell me what's bothering them, what is their fear, and really address it from a compassionate lens to be able to help them. And then the fact is too that this sort of earth suit I have, it's a woman and it's land. So there's a lot of extra barriers that we all have and biases we all have. And so we have to overcome even that to go ahead and trust me. So because it'd be very different if I was a the common 90% of urologists, male or white or whatever. So it is very different level to then relate to somebody, and tell them these things are so personal and private. And I am humbled and honored by the ability to give him that trust. So that makes my day very meaningful in my day job. And then I try to really integrate that, with everything I do and with conversations with people, just like today.
I was so impressed by all of your magnificent posts in social media. And I realized I resonate so well with your philosophy and what lights you up and so forth. We had to have you on. Let me begin by asking you, where does your purpose spring from? What inspired you to become a physician, first of all?
For a physician, I mean, I did not grow up thinking I'm going to be a physician. I didn't have physicians in my life. My mom was stay-at-home, mom. She didn't, have a job except, the full-time mother, which is a huge job, but not outside the home. And my father was a businessman. He owned a photography business. So, it's not like I was exposed to medicine or people in the medical field. But as I said, I grew up in Mexico City. My parents separated when I was 12, and we came to the U.S. and my father stayed in Mexico. And my father, is Mexican. He was, very good looking. He had these blue eyes and sort of olive skin. And he sort of stood out, from the rest of the country where it's not very common to see that. He was very good looking, very proud, very vain of, his appearance. And one of the times when I went back to see him in the summertime, he changed from his normal appearance and, sort of outlook to picking me up in a wheelchair. He was paralyzed, and I was really debilitated and frail and very thin. And, I had no idea. I didn't know that was happening. And it really wasn't talked about, like, why this was happening, but clearly there was a change in health. And then I remember, he would take me, let's go to see this person's going to do some massage or something to help me release this pinched nerve. I'm like, pinched nerve what? I mean, like, he's paralyzed. I don't know what this pinched nerve. So, during that time, I remember, he was in a wheelchair, he was in bed, he had a diaper, and it was a very different way that he used to interact in the life and world. And I remember thinking, it's so important to give dignity during those times of illness, obviously in wellness too, but during illness, especially, and I did not know this, but, when you're in a hospital, you're stripped of all these things that, are your exterior things that become personal, like your clothes, your perfume, your cologne, whatever it is. You don't have all those things. You have a gown that's open in the back and shows half of your behind. And it's not really something where you feel there's going to be, you just feel so vulnerable and so truly naked. And so I thought it's so important to sort of give that back when you are ill. And again, I didn't have a thought that I was going to be in medicine, but when I did come back to Los Angeles in college, I was in college at the time. I was a second year, and I decided I want to pursue medicine. I think this is something I want to do, and I want to bring back that dignity that I didn't know it was lost or not, but I felt like that was important to bring. So my passion for medicine was not really, I want to be the biggest researcher or the best surgeon. It really is about humans and about that connection and about dignity. And it really was about having those connections and truly being a healer and a teacher, which is the definition of a physician. But I think we have lost some of that. And I did not know that either until I got here. But, we are prescribers, we're transcribers, we do all these things, but we forget that healing, that listening, that presence that is so important, which is part of healing.
I tell the people that I take care of, if you want someone who's going to treat you, probably need to find someone else. If you want someone who's going to care for you, that's me. I will help. I can care for you. I don't want to be treated. I want to be cared for. And when you talk about being a healer, not a provider, when physicians became providers, everything went downhill. We have less than a minute left. I'm going to turn it back to JC.
Yeah, this is so interesting so far, and I tell you what, it's great. When we come back, we're gonna pick it up because we got a lot more coming from Dr. If you want to be part of the conversation, all you have to do is go to the platform that you're watching this on, ask any question that you might have, or pick up the phone and dial 1-888-344-1110. Is your life, and we'll see you shortly after the break.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
Order your copy of A Black Man's Point of View by author Dr. James J.C. Cooley today from Amazon.
Dr. James J.C. Cooley. The James Cooley Show. It's your life. Dr. James J.C. Cooley. The James Cooley Show. It's your life.
Country Boy, City Boy, A Journey That Ain't Over Yet, the true life coming of age story by James J.C. Cooley. Using humor, wit, and engaging storytelling, James paints a picture about his arrival in a rural Deep South town and realization that life would never be the same. Cooley lays out his struggle to adjust from city life to country life and back again, sharing his hard-earned lessons to educate, encourage, and enlighten our next generation of leaders and heroes. Get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
The James Cooley Show. It's your life.
Hello. Welcome back to the James Cooley Show. It's your life, and I tell you, we are having a great time. I mean, I know you said urologists and all of that stuff, but guess what? We all, maybe one day in time, need a urologist, and we need to understand exactly what they do, how they can help us out, how they can help us stay healthy, or when we're having major issues, how they can fix those things. So I tell you what, you got one of the best in the business, Dr. Diana. Oh yeah, if you got any questions or anything that you might want to ask, all you have to do is just go to the platform that you're watching us on and leave a comment, or pick up the phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. So Doc, can you discuss the diverse range of medicine conditions pertaining to urology?
Yeah, absolutely. So most people are confused. What do we do, or who are we, or what's going on? So we basically are surgeons that take care of anything where the urine passes and the gland above the kidneys, which is the adrenal. So there's a gland on top of the kidneys called the adrenal that takes care of a lot of functions for metabolism. And then the kidneys and the ureter is where the urine comes down from the kidney. Then there's a bladder, and in men we have prostate, urethra, and the testicles, all the genitals. So anywhere, again, where urine passes or anything relating to the genitals or fertility for men mostly, we definitely we deal with it. And this may be things that are medical, or these may be things that need surgery, because we're a little bit different than a nephrologist, who's also a kidney doctor, but they're dealing with different things to keep the kidneys healthy. So if something is anatomically wrong, we may fix it, but we also take care of things that are not anatomically, but may bother you, like peeing too much, peeing too little, not enough, all the things like that, or leaking and that. So there's a lot of things that encompasses. And as a urologist, you can take care of children and men and women, or all of them. And sometimes I have patients that I take care of the kids, the parents, and the grandparents. And it's actually really fulfilling as a specialist to be able to do that and to have their family members come to see me. So it's a wide range of patient ages we treat. And mostly, yes, I deal with 75 plus, and I have many patients 70, 80, 90. But we also see people at 22 and have issues that we can help them with.
So you have branched from traditional medical practice to creating physician coach support. You've become a coach for other physicians, and I suspect bring it into your practice with your patients as well. Let's talk a little bit about that. Tell us about how you moved into, and what prompted you to move into coaching in medicine.
Yeah, that's a great question. And that came from the fact that, as I mentioned in the intro, in many physicians, with 50-60% of all physicians are in burnout. And burnout is chronic unmanaged stress leading to symptoms, which may differ on the person, and it can vary different times. The first time, the second time, it may be very different. But many times, at least for me, the second time, it was very long, very painful physically, showing the manifestations of, again, chronic stress. And that was hair falling out and weight loss. I've been grinding my teeth to the point, I damaged a molar, I got an abscess, had to have a root canal. I deal with asthma at 42. Asthma is an inflammatory condition of, the lungs and the air spaces. So now I developed it at 42. I had debilitating chest pain. I couldn't sleep. I, at the end, began to have joint pain, and I'm a surgeon. So you have joint pain, and they did some testing, and the rheumatoid factor, which is a blood that you find in autoimmune diseases, was elevated. So not only was I having all the body parts, having issues, but attacking the body itself with the autoimmune disease, because the chronic stress affects every single cell in your body. It doesn't spare anything. So we're going to have, the tightness in the shoulders, the pain. As urology, I see a lot of pelvic pain, bladder pain, and frequency, urgency to pee. And that is all secondary to stress. And if you don't address that, and if I only give you medication or procedure or surgeries for that, and I don't address the underlying cause, you get better, but you're not going to heal truly. You're not going to get rid of that problem and all the other problems, because the likelihood is you also have a cardiologist, your heart doctor, you have a gastroenterologist for all your bloating and indigestion you have, and you're going to just go to multiple specialists trying to find why you don't feel well. So, it's not just in my specialty, but, it's really is psychourology. I have to address the mind, the social, the spiritual, what gives you purpose, what's important to you, in my treatment plan. If I don't address what's important to you, I'm going to miss the mark. I'm not going to really get to the root of how I can better help you.
So let me ask you this. What are your hobbies and passions in terms of outside of work? And then I want to know how you balance. I mean, it's so magnificent that you bring this interactive, holistic approach, lifestyle medicine and so forth. But what about your own personal hobbies and passions and interests?
Yeah, I love cooking. I love traveling. I run, and I also do yoga. And sometimes I bike. I don't really bike as much as my husband at all, and it's been up to years. But before, when we used to live in the West, I used to bike a lot down the bike path, Manhattan, all the way down by the beach. But I do like to be active. I tend to have a lot of energy, so I need to sort of burn that energy and excitement. So I need to do something physical and active. Or now we're closer to the mountains, so we can hike and do that with my children too. They love to hike. So, being outdoors is really healing and helpful. So I like to do that and just really connect with people, again, friends, in a deeper level. That's sort of part of my fun.
That's fantastic. Balancing work life is so important for physicians. I spend a lot of time teaching physicians about burnout and whatnot. And they talk about the fact that, I don't have time in my life. I'm on call. My life is owned by the corporation that owns my practice and all that stuff. How do you help physicians deal with this stress and begin to melt it away?
Well, the main thing is we have to understand how we are speaking, because just saying we don't have enough time is a scarcity mindset. And, it's rampant. I hear every day, I don't have enough time. I don't have enough. If you don't have enough time, then you also don't have enough of everything you see, because what you're putting your attention to and how you're speaking, your words have a lot of power. So then you do that to everything else in every facet of your life. So pay attention to how you speak, what you're saying, also how you're speaking about yourself. I hear a lot of sort of self-deprecating language that people use about themselves. So you have to pay attention to how you speak about yourself and the words you use. But it's also important to understand boundaries. Boundaries is so, so critical to learn to say no, especially for a woman, but also for men. They don't know how to say no or no thank you, and that's going to leave you depleted, overwhelmed, angry, because you say yes to so many things. And then you wonder why you're not having time to do the things you want, and why you don't have time to do your hobbies and the things that bring you fulfillment, because you've said yes to everything else. So I think boundaries are important. Very, very important. And we have to start there and have some mindfulness of how we're saying things, how do we speak about ourselves and obviously about others, but it starts with the self. If you're full of fear and anger and hate, it's going to affect everybody else.
So you just hit on a absolutely great point. Mindfulness, you mentioned that. Does holistic medicine, I know you're a regular medical doctor, but do you encourage or patients sometimes meditation, certain other things that might be contributing to the problems that they are having? So what advice, other than the medical terms, that you would recommend others to do to calm down, to relax?
Mhm.
Because a lot of times I believe we have things in mindset going through our mind, and that pausing the body with other things because we can't function right. What are your thoughts on that?
Yeah, absolutely. I mean, that's part of what I prescribe, and I really do write it in their after visit summary. I put, you've got to do this. You've got to, go on the hike, work on your car. That's your hobby. But really, for everybody, including my patients, and we talk about this a lot, is you've got to set a time every single day to slow down. It has to be done. It's not an option. It has to get scheduled every day, a time to whatever you do, whether you call it prayer, whether you call it meditation, journaling, quiet time, whatever name you like to put it, but it has to get done because you have to stop the stress cycle, all these things that, we get faced with every single day. And we got to have a time to slow down. And it's not just going to happen by itself. And it's not going to happen if you go to the spa. I mean, it's good. That's a starting point. But every day, just like you brush your teeth, and we want to prevent cavities, every day you have to do preventative things for your own health, for your own spiritual health, for your own emotional health. So we don't really do a great job about prevention, even in medicine, of course, but we have to do that in our own lives. And to be able to slow down, you have to set that time to do it. It's not going to just happen by itself.
I think Nate, go ahead. I'm sorry, JC.
What specific life coaching techniques do you find most effective? Because one shoe don't fit all. And depending on who the individual is, they process of thinking, all of this might not be what Ann think over here or what John think here. So how do you determine what methods to recommend to your clients and patients?
Well, it depends. Everybody's individual. That's sort of the art of the science. It's not one size fits all. And what helps one person doesn't help the other. But it's going to the why and to that person's why and purpose and what's important to them. And just asking, what is important to you? And I think a coaching principle is very important. When somebody tells me something, it's sort of asking, like, is that true? Is that really true that, again, like even just going back to it, there's not enough time. Is that true? Really poking holes on these beliefs that we now truly think they are reality, and that's not true. So going to asking that, is important. And also just asking, like, why or why not? Why are you doing that or why aren't you doing that? Because behind that, there's a reason why people are not taking their meds, not doing this, not eating healthy. Something is happening beneath that.
So something is happening there. We got to take a station break.
I was wondering how you're going to get that in.
We got to take a station break. But I tell you, I don't want to, but I got to pay the bill. If you want to be part of the conversation, all you have to do is just go to the platform if you're watching us on. Ask any question that you might have, or pick up that phone and dial 1-888-344-1170. Again, that's 1-888-344-1170. It's your life.
There's more stories of greatness to help you overcome adversity. Coming up on It's Your Life with James Cooley.
The James
Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be on it, to be in the Coffee Book 2023, Unified Brain Z, and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
The James Cooley Show. It's your life. That's right.
On Amazon or wherever books are sold.
Dr. James J.C. Cooley. It's the James Cooley Show.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, Dr. Diana is putting it out there. Everybody gonna have a doctorate degree once they finish, and she give them the test. No, Doc, I want that information that you are sharing with our viewers and our listeners is so remarkable, and so I just really appreciate what you do. You know, before we get started, if you ever in Temecula, California, they got this great pizza pub called Rosati's Pizza Pub. And I tell you, I don't know if you guys like deep dish pizza, but wow. You eat some of that pizza or a slice of that, you might want to slap somebody, but don't hurt nobody, because we got these the doctors here. But no, I tell you what, that's and deep dish pizza, but it's more than just that. He got maybe another 30-something things on the menu. Everything is delicious. Every time we're back home in Temecula, I always got to go by and give me a deep dish pizza. So Rosati Pizza Pub of Temecula. So delicious. Hey, Doc Mike, I want to get back to this. You had a couple of questions that you had.
Yeah. I think that people go to the doctor, and the doctor spends a lot of time talking, hopefully, about you and asks you questions and so forth. Let's pull a curtain back just a moment here, because I know Dr. Londoño is open and willing to discuss this. How has being a physician changed your perspective on life?
Well, that's a big question, but
I don't have easy questions.
So I mean, there's so much, first of all, that we can learn from each other. I think that's one thing. I think people think that you're only going to learn, like, that the physician has all the answers, first of all, and that's actually not even true. The patient has all the answers and all the information, and that you have to honor their knowledge, their wisdom, their body. They have all the information, and my job as a physician is just to sort of get the most elegant way to get that information out, so then I can understand what's happening and I can help them. But the information the patient has, and also that they're just there to learn from me, but actually I learn from my patients. There's so many beautiful things I learn. They share, we cry together, with patients. Like, they grieve, they lost their spouse. There's so many things that happen in their lives. They have grandkids. They show me the pictures. They see my kids' pictures. So it is really as a relationship, that is so rich if you are willing to sort of open your heart a little bit and get past just the medicine and the didactics and the testing. It really is, seeing 20 patients, however many you see a day. It really is. I look forward to it. I get excited. And, I walk in the door, I'm like, hi, how are you? And they're always like, where are you going? You're dressed up. I'm like, I'm here. This is the party, and they kind of laugh. But, it's sort of like, I'm here, to take care of you and to talk to you. I want to see how you're doing. I want to hear an update, not just about how you're peeing, but what's happening in your life. That's important. And that's important to them, is important to me. Their eyes light up when they tell me about their plans to go travel. They're going to go on the guys trip, go fishing. I mean, that's important to them. So I want to hear about it. So there's just so much to learn. And I think when we come into it and let go a little bit of our ego and just come in with some curiosity, and it really can change how you see your day. Because if you come thinking you know everything and you are the expert, that's one way to do it. But there's a richer way when you're willing to learn and you're willing to be curious and understand a little bit more, instead of coming like the expert. But we're told we're the experts. We're sort of groomed a little bit to have this big persona. And again, that is a way to do it. I don't think it's like the best, richest way, but that is a way that we can continue to do it.
Dr. Diana, so when you talk to your patients, do you sometimes learn more about what they're doing that may be contributing to certain issues as far as their medical state is concerned?
Oh, absolutely. What they're doing and, what's important, or, like I had a patient 2 days ago telling me about they started having pain, like bladder pain and frequency. And I said, oh, interesting. When did this start? 3 months ago. I'm like, okay. And then she tells me everything else. And then the nurse had told me, oh, and by the way, her spouse just died. And I said, okay. And then I said, I'm really sorry to hear that your spouse died. I said, when did this happen? And she's like, oh, about 3 months ago. And I said, oh, well, do you think it could be related, your symptoms, to what's happening? And she's like, she got very teary-eyed, and like her breath kind of went away, because she's like, yeah. And she said, I thought I was crazy because I didn't really know if it was related. But I'm like, you're not crazy. You're human. What's happening affects you, and you're grieving and you're having pain, you're holding on to it. And she also had like debilitating. She said, I had the worst back pain I've ever had, and I had to go to the hospital for that. And I said, isn't that interesting? So it's like, I'm curious, and I validate her experience because it's really important. Her spouse died suddenly, and it was tragic, and it's painful. And even though it's been months, it's very painful. So if we don't spend that time or get curious or ask, then I'd be like, oh, okay, 3 months ago, here's your medicine. Have a nice day. That doesn't help. So I think, a lot of what I do is listen. And you see my reviews, it's like, oh, Dr. Londoño, listen. Dr. Londoño, listen. She explained things in a clear way that is not this mumbo jumbo. Like, what does that mean? Like, nobody understands what you're saying if you say some big word. Why are you using the big word? It doesn't make sense. I don't understand. Even when my colleagues tell me something, if you tell me some big, even urological, why do you have to use a big word? Just tell me what it was. So when we come with humility and we really just are at the same level of like, let's make this easy for everybody, like, then people understand. When I explain to patients, like, this is what this pill is for, they're a lot more like likely to take it because they understand why. If people don't know why, it doesn't make sense, and they don't buy into like whatever you're trying to do. So they have to know why, and then they're going to be so compliant because they understand. And if they're not, I want to know why. Are you afraid? Did you have a side effect? Was it expensive? Did you like not get to the store? What happened? I'm not going to blame you and shame you. I just want to know what happened so that I can adjust my treatment. So even when people are not, you have to know why. There's always a reason.
I'm curious. You mentioned earlier about the physician believing that she or he is at the top of the ladder, the expert. And there's a lot of stigma to pulling back the curtain and revealing a vulnerability. And we see that more and more doctors, especially people who are writing books today, are sharing a vulnerability, and then the book takes off because I'm sharing my weakness. Okay. But when you talk to physicians who clearly are in need of some emotional help, coaching, what do you say to physicians who are afraid to get support from a person like yourself through physician coach support? How do you help them get through the fear that they have about revealing something?
Yeah, I mean, it's sort of like why or why not? Why? Like how much pain are you willing to endure until you're gonna say it's enough? Because it's gonna get to that point where it's gonna be enough pain that you're gonna crash and burn. And we all maybe have to do that to be able to turn the corner. If I didn't burn out crispy, then perhaps I wouldn't have sort of changed my path, because pain is the biggest teacher. And if you don't have that pain, you're not going to change your course, because everything seems fine until the pain is so severe, spiritually, physically, mental, however it is, that you're going to hopefully make a change. So,
you know that in motivational interviewing, we ask the question, if you change, what do you think will happen? And if you don't change, what do you think will happen? So sometimes that recognition, like you're raising, is so important. And the point I guess you're saying is that, yes, physicians have the same feelings that patients do. They may hide it behind the white coat and the stethoscope, but it's important to know. And JC, we have a minute left. What do you think?
Well, you know what? Hey, Todd, don't get mad at me, man. I don't want to take the station break, but I have to. This is so intriguing, and this is so educational, so wonderful. And I'm just hoping that you guys are gathering this information like I am, like Dr. Mike is, like Dr. Diana. I hope she don't mind me saying Dr. Diana. And if you want to be part of the conversation, all you do is go to the platform that you watch this. Reach out. That's any question that you might have. Or you can pick up the phone and dial 1-888-344-1170. Let me break it down. KCBQ AM 1170, FM 96.1, and live syndicated every day live. It's your life, and we'll see you shortly after this.
There's more stories of greatness to help you overcome adversity.
It's the James Cooley Show. It's your life. Dr. James J.C. Cooley. Yeah. Come on.
Both a cautionary tale and a roadmap to achieving the American dream. This is a must listen for anyone who thinks they're
the James Cooley Show. It's your life. That's right.
life circumstances.
Dr. James J.C. Cooley. The James Cooley Show. It's your life.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what?
Hello, welcome back to the James Cooley Show. It's your life, and wow, I don't even know what to say. This is good. Hey, Todd, what are your thoughts so far?
It's been a great show. And, I have to say, listening to Dr. Londoño, anybody that is a patient of hers is very lucky. The way that she talked about, the importance of being a healer and not just a doctor and everything. I got to say, those are some lucky patients.
I think they're lucky, and the two people that she operated on this morning are lucky as well. Just come on. Oh, I love that surgery. I just did too.
It's really fun. It's so fun.
JC is switching urologists. I can tell right after me. You're going to get a whole bunch of new patients out of this.
Absolutely. So, hey, Doc, I just got one quick. I know Michelle and Doc got other questions. What advice do you have for other medical professionals interested in incorporating lifestyle coaching into their practice? Because just like what Todd just said, is you make it fun. At least you present like, oh, I want that's my doctor right there. I mean, not only is she gonna operate on me, but she gonna teach me, educate me. What is your advice?
Yeah, I mean, for physicians, every other, field, they embrace coaching. If you're in the C-suite, if you are a rock star, if you are on TV, everybody has a coach of not just one. You have a business coach, a marriage coach, finance coach. You have all kinds of coaches, media coach. So it's like, why don't you embrace this? That is something that can help you just grow or get from place A to B to C, whatever it is, whatever your goal is. It's sort of taboo-ish, in some ways. Many are resistant, some have accepted it, some are all the way in, but it's just a tool to help you in your growth. And if we only focus on our academic growth and this and how to get to be a chief or something like that, that's important, of course. But like, how about your personal growth, your spiritual, whatever facet you want to do, your relationships, and everybody you come in contact, it's a relationship. So we need to learn those skills, and some of them are communication skills, and that you can get from a coach or coaching and understanding those principles. Learning, again, like we talked about earlier, how to say no, how to prioritize, how to make a schedule for your week to be the most effective and efficient, and really prioritize the things that are important, which are actually usually sleep should be number one and the first thing you schedule of your week. But again, in society, we are told sleep is optional. I'll sleep when I die. This sort of belief system is so backwards. Sleep is so essential. And it was not taught when I went to med school how essential it was and all the benefits of it. And we put it the last thing to do. But if we have these beliefs that we never question, is this even true? Should I follow this belief? Then how are we going to get to a better place? So it's not about being a disruptor, but sometimes we have to ask why. Like, why are we doing this way, or why not? Whether our coach can help you just kind of maybe tap into that mindset of asking those questions. But if not, maybe just start yourself. Whatever you're doing in life, why am I doing that? Or like, why am I not doing that?
I teach every year I teach a 3-day physician wellness studio for the American Society of Hematology. This year it's going to be in San Diego. But one of the questions that we talk about is, if you hadn't become a physician, what else would you have become? And I'm wondering, Diana, how you'd answer that question.
I mean, to me, there's so many things, but I being a speaker, motivating people to really have them see their own light. I think it's so important. So many people can find the dirt in everybody, but let's find our light and have somebody show you that you have light when you have lost that hope, when you feel lost, overwhelmed, just hopeless. It's just really, giving that person that space and that permission to see that. And really, in all the things I talk about is like understanding, that you matter, that you're worthy, and that you're light, and just understanding these principles, even if you don't believe them yet. Borrow that belief for a little bit until it feels like it's your own. And then that way you can get to whatever you want to do in life, whatever your goals are, medical, non-medical, relationship wise, that is a really important thing to think about in the morning.
So your answer is, if I wasn't a physician, I'd be a healer, a helper, a carer. Guess what? That's what you do. Your answer is magnificent because you're saying, I would help people this way instead of that way. It's who you are. You bring that out. And that's the energy that you have. It's wonderful to see. And then I want to shift gears and ask you a more technical question. Technology is moving into our lives everywhere. We saw today there was a blackout and everything went down. Airports and banks and whatever it went down today because of some difficulty. How is technology moving into your medical specialty of urology?
Well, I think it started really in a big way with like robotic, surgery. So that was a big game changer, especially for prostates. Before, prostate surgery was done open, and then it was done laparoscopic, which didn't work so well. But then the advent of robotic surgery really changed so much the recovery, the side effect from the surgery, and it really, helped many men, again, decrease the risk of the side effects from removing the prostate, which would be erectile problems or leakage, which, are a big deal, of course, for a man. So that was huge technology improvement in our field. And also, not technology per se, but medically, for metastatic prostate cancer, there's so many more treatments that we didn't have available even when I trained. So that is huge, where many men can live a very good life with metastatic prostate cancer. So we've seen that. And obviously now with AI, there's always new technologies, even for prostate enlargement, like we talked about aquablation today. There's many new things that come that, again, every time are reducing some of the side effects that are not ideal. So it's always evolving, and it really is, changing to a exciting time.
Wow. We're down to the last minute and a half of the show. But first of all, I'm gonna have to do this, Doc. I got to do it. I
know what you're gonna say.
Hey, Dr. Donna, I don't know if your schedule allow you to come back on the show again, but you are an absolutely fantastic guest, and that door is open if you like.
Oh, I'm coming. I don't wait. I'm coming.
I got to thank my main man, Dr. Mike. It's good to be back on the team, sir. That's why me being back, and it's my team. And I'd like to thank Dr. Michelle Cooley for putting together another absolutely fantastic show. I'd like to thank Todd Pyrick and my KCBQ Studios, syndicated, prime time, San Diego. Most importantly, I'd like to thank our viewers and our listeners for tuning in to the James Cooley Show. It's Your Life, Monday through Friday, 2 p.m. Pacific Standard Time, 4 Central, and 5 Eastern. Always dream big, think big, and be big at everything that you do. We'll be back tomorrow. Same time. It's your life.